TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
Anthony, it's nice to meet you for a second time here. It's nice to meet you. Thanks for being with us and talking to us a little bit about your perspective on health and in particular mental health.
Mhm.
So I was wondering if you could tell us a little bit about what you do and sort of your perspective on mental health.
Mhm. My name is Anthony Guzman. I'm a Chief Cultural Officer at the Native American Health Center. I'm also an enrolled member of the Northern Ute Tribe. And so, I take ancestral wisdom, cultural knowledge, traditional wisdom, and my responsibility is to integrate that into our healing framework at our health clinic.
Uh-huh.
It can be a little challenging because we're taking two very different types of approaches to mental health and amalgamating them together to create something beautiful. And so at every turn, we want to make sure that we are taking the things the people that came before us and making sure that we're honoring our ancestors and making sure the folks that come through our doors, the most vulnerable folks,
Yeah.
have an opportunity to get mental health services, dental services, WIC services, school-based health, prevention, and early intervention. We
Yeah.
do a lot at the health center. So, it's my responsibility to make sure that we serve the community in that way.
That's awesome. And thanks for your service and your leadership on that. I have to say, seriously, you mentioned the word challenging, and I want to go back to that a little
Mhm.
bit because for me, mental health care delivery has, at least in my career, or my lifetime, from a system standpoint, has been challenging. It's been challenging. It has not gone easy, and I believe we have a long ways to go. So I
Yeah.
wanted to get your thoughts first on more specifics on what that challenge is exactly. You mentioned sort of commingling, two different sides to mental health. If you could go into that a little bit more, and then the most exciting piece is how do you how do you reconcile it? How do you address those challenges and reach towards success in this area?
Well, that to answer that question, I have to go further back.
Yeah.
Now, when we talk about what is the challenge in the mental health, specifically in the American Indian community, this goes back to a systematic erasure of the first people of this country.
Mhm.
When we look at what that historical trauma, the intergenerational trauma,
Mhm.
and the lived trauma of
Mhm.
those folks that have been impacted by those challenges, we are looking at a very uh, a complex issue that a Western mental health system
Mhm.
has oftentimes not been able to address.
Yeah.
And so when we look at, okay, how do we take current mental health practices and look at a very unique population of people that has suffered for so long, but oftentimes by the very system that impacted them,
Yeah.
we do see challenges. And so that is where my role as as the chief cultural officer is to address those things. Now, my background is I'm a social worker, so everything I do, I look through a social work lens,
Mhm.
and that social work background was impacted and by my cultural and traditional influences in my life.
Mhm.
Now, when I was a direct service provider,
Mhm.
my data was how many assessments did you do? And how many one-on-one
Yeah.
sessions did you do? How many groups did you run last week? And that was pretty much my data.
Yeah.
Now, how do we look at success today? Well, now I've had a different kind of understanding of what data
Mhm.
and data-driven information and decision making looks like. So now it's almost like, how do we define success? How do we look at quality
Mhm.
as opposed to just quantity?
Yeah.
How do we develop measurement tools that are more unique and community defined?
Mhm.
How do we look at creating more therapists and clinicians and clinical psychologists that are looking through the lens from a traditional perspective? So success is starting to look like taking ownership back
Mhm.
of not only just the systems, but really redefining on what mental health looks like. There is a aphorism in the Native American populations of the Americas, and it is all my relations. And all my relations is a powerful statement in the regards that when one of the most profound and powerful experiences of humans is to have a very conscious awareness of being in relation
Yeah.
and being in relation. And so what I mean by that is, what humans look to the stars for, you know, a deeper understanding of our
Mhm.
existence.
Mhm.
We look to each other,
Mhm.
our brothers and sisters, for accord and compassion.
Yeah.
We look to, you know, we look to the earth. We all drink water. We all breathe air. We all walk a path.
Mhm.
And so, and we look inside. We look inside of ourselves to find strength
Mhm.
and that perseverance and our identity. And that's all my relations. And that is what we, as Indigenous people, as the Native American Health Center, we look at that, all of our relations, to say, how do we address the mental health issues for our population?
Well, I think it's important. I like the way you put it, by the way. Looking at your relations, and it sounds like it's not just present though, it's past, and it's probably looking into the future too. But a great perspective, and it also makes me think. What years ago, a couple decades ago, when I got out of formal training, I realized something. I realized that the more I know in medicine, the more I don't know.
Hmm.
And so the perspective that you have is really intriguing, and bringing in the traditional components, with your community, I think is essential. There's so much we don't know about mental health. When you look at depression, anxiety, schizophrenia, bipolar disorder, the fact is we have no idea which part of the brain is affected. We don't know which neurochemical is affected. We don't know the cause of this stuff. And certainly we do our best to try and figure out which medications can be helpful. But I think there's a big piece missing, a big piece that's missing. And so when I hear you and talk about the relations and to talk about the connections,
Hmm.
um, that sounds like an important piece, you know?
You know, m- mental, physical, spiritual, emotional, and social.
Yeah.
In order to address the mental health needs of a very, complex population of folks, is we have to look at all of those aspects, and and as you said, we look to in history and our ancestors, and oftentimes when we look back, people like to see the tragedy
Mm.
and the devastation. I tell our young people and my colleagues and community members, don't forget to look at also
Mhm.
what allowed you to be sitting in the room today. And that was adaptability, courage, perseverance, fortitude. There was a tremendous amount of intellect that allowed the people to be here. So let's also remember that we are looking at not just historical trauma, but we're looking at historical excellence as well.
Yeah.
Now, I also think that, when I'm looking at somebody with these severe mental health problems, that we do have to take into consideration. Are we isolating our relatives? Are we are we making sure that they have social connection? Or are we making sure that eating food that is allowing them to have the building blocks for a very deep conscious awareness and building back something that might not have been there or something that has been lost.
Hmm.
And I think we really look at you know the spiritual connection that each individual has. It might look different for everybody, but to ignore that in our our human experience, and that is I think a mistake. And that's why the idea of all my relations, each and every single one of us, all the things that I'm related to are very important. And if we leave one of those out and maybe focus on one specific area, we may be neglecting a bigger picture.
Yeah.
Yeah.
It sounds like you have to bring in all of these pieces. It can't just be physical. It can't just be medical.
Hmm.
It kind of can't be. And you're seeing it from from a couple different lenses, social worker lens, and
Hmm.
from working in your community and your culture. That's a specific lens. It almost makes me wonder if we bring all of these pieces together, if it results in a better outcome, right? So you're looking at the physical, you're looking at the medical, the medications,
Hmm.
but you're also looking at the spiritual, you're looking at the past, the relations, and putting all of and the nutrition, and you're putting all the pieces together. I think sometimes we miss that boat in traditional psychiatric practice or medical practice for a lot of reasons. Maybe
Hmm.
life is busy. There's not a lot of you were social. You saw a lot of patients, so you saw the demand to see more and more clients or patients, and you dealt with that. And that's the world we live in now. And it's kind of a bummer because it would be nice if we could find a way to integrate all of the stuff that you're talking about, to bring it all together. Um, how do we do that?
There's some, and that's some of the exciting things that we're doing at the health center right now. And
Yeah.
one of the most powerful statements that we have at the Native American Health Center is culture as prevention. And what our team has done in the community wellness department was, you know, California reducing disparities uh, project helped us find a tool, a a a a, a tool that helped measure uh, the impact of culture, and
Uh-huh.
not just any tool, something that went through rigorous research and and that was validated. And we found one by a woman named Angela Snowshoe, and it was specifically for a tribe in some of the northern territories, I believe, maybe a little bit above in Canada.
Mm-hmm.
Well, Angela Snowshoe went through years and years of asking elders and community members, what are the things that are culturally significant and how do they impact your overall
Yeah.
health? And what she found out was over years and years of studying and getting these questions down, she found that her research found that if you integrate culture
Mm-hmm.
into the lives of these community members in the American Indian community members that she was studying, that their positive health outcomes went up.
Yeah.
And that was just
Across the board.
across the board.
Yeah.
Positive health outcomes went up. So this is a validated tool. So we saw research there. And this is where the research part where I am learning to say, okay, I need to look at what I do from a research perspective to really um, understand how to better serve the community. So what we did is we contacted Angela Snowshoe,
Okay.
and we took her tool and we adapted it to an urban Indian community.
Huh.
And over years of decade of research, we created our own tool that was the cultural connectivity scale California for the Bay Area community. And so what did we find? When you provide culture to a community, to the Native community,
Yeah.
the positive health outcomes came up. So now we want to take it to the next level. If we now that we know that if you integrate culture, positive health outcomes, let's ask the community, what types of cultural practices do you want?
Interesting.
So we went to the community with this last research a year ago,
Yeah.
2 years ago, and we called it the Medicine Bundle Survey.
Hmm.
And we asked, from 18 years old to our elders, what kind of cultural activities would you want? And it ranged from, we want access to traditional health practitioners. We want spaces where we can access traditional medicine. We want a place where we can grow our own food. We want a place where we can be loud and sing and not have any worries of being told to keep it down or whatever it is. So we took what the community said that they wanted and started to integrate that into our care network and our services there.
Interesting. Wow.
And now we're going to take it even a step further.
Uh-huh.
We're starting to develop a new system of saying, if we have a patient come into our system of care,
Yeah.
we're going to provide them with the CCS. And we're going to find out, these subscale says, maybe they have strength in their identity, but maybe could need some support in maybe their ceremonial aspect. And we'll get some feedback from this scale, and then we'll sit down with them and we'll develop a cultural wellness plan for them.
A cultural wellness plan.
Yes, a cultural wellness
Interesting.
plan.
A cultural wellness
And
plan.
then in this cultural wellness plan, they are our co-conspirators here. We want to make sure that the relative is telling us what they want.
Yeah.
Now, if we take that, we get a baseline metric, and then we take all of the services that we provide, whether it's access to a traditional practitioner,
Yeah.
certain types of ceremonies, people to go into a drum and dance class, arts and crafts, and we'll take those services and integrate it into their cultural wellness plan. And that cultural wellness plan can go back to their workforce development plan and not only, support it and individualize it, it could go into their behavioral health plan.
Mhm.
And so what are we doing? Are we prescribing culture for mental health into maybe they're doing EMDR, maybe they're doing CBT, maybe
Yeah.
they're doing, emotionally focused therapy, and supporting that and individualizing that with cultural wellness. And I think that this has ramifications, not just for the Indigenous community, but for all people.
Yeah.
Yes.
And their cultures.
Yes.
So I have to ask, Anthony, so this is really interesting to me. And, I've been in this space a long time. And as I hear you talk, I'm like, wow, this is pretty cool. So I'm just curious, is any of this been replicated nationally outside of the Bay Area in Northern California? Is this stuff happening elsewhere, or do you see what you're doing in the Bay Area, Northern California, as sort of a leader in this space to hopefully replicate it and move it out nationally or internationally even?
Paul Masadi is our director of research and evaluation. And when people around the world read the literature out of the journal articles that was started with the culture as prevention, they want to know. We want to understand
Yeah.
more about this. And so we also, when the medicine bundle literature went out, people were like, we want to know more about this. And so
Yeah.
this is the latest kind of innovation of like, how do we keep on growing what we're doing? And we do believe like this is something that can be replicated across the country, because we know that the CCS can be replicated for a community.
Mhm.
Who's to say that you can't go into your community and ask them what kinds of cultural, activities would you like to see?
Yeah, yeah,
And who's to say nobody else could do a cultural wellness plan?
yeah.
And so these things for us is like, I think the innovation is profound, and I think that there isn't any reason why this couldn't, impact healthcare on a much grander scale.
About 20 years ago, the American Psychiatric Association came out with something called the cultural formulation.
Mm.
And this is put in their, the DSM
I'm
5.
familiar.
DSM, back then it was DSM 4 probably.
TR. I was a TR guy.
Yeah.
Yeah.
And cultural formulation. But I like your approach better, right? Focusing on cultural and wellness and a plan. So how do you move forward practically with wellness that's intertwined with with culture and being mindful of culture? I've never heard of those 3 words put together. I'm sure they have been, so don't quote me on that, but those 3 words, very simple, but put together, I think are powerful. And so it's neat to hear that. When I think of a lot of folks in your community, I think of a couple things in terms of risks and vulnerability: diabetes,
Hmm.
hypertension, high blood pressure,
Hmm.
high cholesterol,
Suicide.
suicide,
Hmm. Domestic
depression,
violence.
domestic violence, depression,
Yes.
probably a higher incidence of alcohol use or misuse. Um, and I think that's all connected to this word you used earlier, this word vulnerability. Whether it be genetic or otherwise, there's a higher likelihood of those vulnerabilities popping up. And so I'd like to hear a little bit more about how you're dealing with that and your approach, not only for the mental stuff, right, depression or anxiety, etc., but the physical, the potential for increased frequency of those physical ailments as well, that are often connected with and make worse the mental state. So thoughts on that?
And I think that's part of where the culture is so key on delivering the message
Mhm.
on why is it important that you take your medication on
Yeah,
time. Why is it important that you don't have to have, get out and, make a million friends, but is it important to get out and, attend a social a gathering?
mhm,
Is it important to find something that is you know, greater than yourselves,
mhm.
or as they would say in the in the recovery community, a higher power.
Yeah,
And I think once you start to have a conversation with somebody, you might not talk about diabetes if you're the doctor at first, but developing the relationship,
yeah,
being in relationship is where it all begins. And so develop that relationship is will help you navigate and maybe get to areas to incorporate that in. And I know that's such a challenge in the modern healthcare system because I mean I got a I got a primary care physician where I got to go in and they want to write stuff down and we they got their next patient going on and I know I know that's challenging to do, but I think it's really building the relationship,
yeah,
whether it's starting off in our let's starting off in the mental health realm or our community wellness realm.
mhm,
Our Department of Labor is one of our departments in our agency. We have WIC. One of the very first questions though is like we want patients to have self determination, sovereignty, you know, and it's like, would you like? I'm curious. Would you be interested in having culture integrated into your treatment plan?
yeah,
And if it's yes, then we could say, well, you know what? We'd love for you to talk to one of
mhm.
our cultural health associates, our cultural health, our cultural health practitioners, and let's see what we can do. Let's see if this will be helpful for you. And that could open up a whole realm of possibility.
What percentage of folks would want that or open to that? About what percentage? What do you think?
Because it's so new, we'll start tracking that data. It's almost a given that uh, as an American Indian FQHC or Urban Indian Organization, I've worked in urban Indian organizations, and I've worked in tribal rural organizations, and
Yeah,
it almost goes without saying that culture must be integrated into the healthcare service
yeah,
in order for there to be a a buy-in. Oftentimes, we have to remember that many communities of color, disenfranchised communities, the systems that were intended to help often had a mistrust.
mhm,
And that mistrust causes people not to return for care or even access care.
yeah,
So the beginning of that relationship is so key. One of the things that we found in the medicine bundle was so powerful and it came out unexpectedly
mhm,
was that a question was around, did you would you return if the healthcare provider um, didn't understand or acknowledge your culture. And what we found with our two-spirit relatives, that upwards to 70% of them said they would not return
Wow.
if they felt that the provider didn't understand or respect not only being a two-spirit relative, but also, their culture.
Hmm.
And that came as an auxiliary of what we found out, which was very powerful.
Yeah.
So, I mean, I'm not. I might have gone off track there a little bit, but I just get excited when I think about that research.
No, I mean, it is exciting. I think going back to what you said earlier, though, things are rushed. Things are rushed, and I work with primary care docs who have 7.5 to 15 minutes
Hmm.
for the patients they see. Um, I mean, I would make a call that we go back to 30 minutes. You're spending
Hmm.
30 minutes. You're talking about culture. You're talking about someone's feelings. You're making the connection, and 45 to an hour, 45 minutes to 60 minutes for first and initial visits. As a social worker too, that's hard to do.
Hmm.
But going back to that, because we were there at one time, we were there. I mean, we had time. Time is important, and to get to know the person you're working with. I'm just curious. Do you see that happening down the road? Do you have a way to make that happen in where you're at?
I think so. We want to crack the code too, because we are also a business. So we're attempting to crack the code here as well. The thing that we're most excited about is that these cultural wellness plans, we are starting off in our behavioral health department, our Department of Labor, uh, 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 our workforce development department, and our
Yeah.
community wellness department.
Hmm.
So those folks can make a referral for these, patients,
Hmm.
and they sit down with our cultural health associates, our cultural health practitioners, and they create it, and then they shoot it back to the referring um, department. So they're not spending all the time in
It's
that
shared. It's
session.
shared. It's a team.
It's a team. So they say, hey, oh wow, does this be something? So the doc or the program coordinator
Mhm.
or the community health worker aren't doing all of that,
Yeah.
because I think also you want to be careful. Is like culture needs somebody who understands it,
Yeah.
as opposed to, somebody that's has thought about it or has been in the periphery of it. It's important that the person that is doing it has a deep understanding
Yeah.
of the culture of the folks that are coming to them. And because sometimes you would have people that maybe don't have the understanding, and they want to learn.
Hmm.
So if they go to the cultural health associate or the practitioner, they may be there to learn.
Learn from each other, right? To
Yeah.
totally. And so this is really interesting because what you're describing is a team-based approach.
Mhm.
Team-based approach, right? And so you have the, physician or the nurse practitioner or physician assistant who may not have a lot of time. We can't crack that. I don't know how to crack that code, but they have X amount of time. It's limited. But we're able to include someone who's going to understand the culture and
Mhm.
spend the time with the
Spend the
patient,
time with them.
and then maybe in some way communicate back to the primary care doc or the mental health provider and say, listen, this is what I found. This is what I think we should work on. These are some additional thoughts. So that team debate, we see this with what we call collaborative care.
Mm.
So we have collaborative care, which includes it's team-based approach, and it's a population-based approach for those struggling with mental health issues in the primary care setting.
Mhm.
This is different, though, I think, very different, but something that I think we should look at and invest in more globally, which is looking at, folks who can really understand someone's culture and work closely with the patient, but in connection with, in tandem with, the nurses and the docs and the social workers, et cetera. But I just have to say, it sounds like you're doing great work, Anthony, and I
Mhm.
I want to really let you know that I appreciate you sharing this with us today and talking to us about the awesome work, the innovative work that you're doing as well. Did we miss anything? Is there anything that that you wanted to mention that you think could really be helpful when we look at navigating through the world of mental health care delivery?
Well, I do want to say that I'm so blessed to work with a very amazing team that we often ask, we always ask in our new hire orientation, whose shoulders do you stand on and why? And that's such a great question for every person that comes through the doors, because we get to hear, why they do the work that they do.
Yeah.
I think of all the people that I'm standing on the shoulders of the work that we do. And, 50 years ago, because of the relocation programs, a group of very determined, you know, um, community grassroots folks said, you know what? We are going to address the needs of our population,
Yeah.
and we are going to do it because who else is going to do it? And so they started off in the most modest of conditions to make sure that they took care of their community, because of they had the understanding of what is all my relations.
Yeah.
They understood that we think of the people in the past, our ancestors that allowed us to be here through their strength. We thought about who are we right now and what do we need right now to support our community.
Yeah.
And they also thought, let's think of the 7 generations to come.
Yeah.
We need to think about the children that are coming and our responsibility to them. And so I think that's also something that I think is so important to remember, is that we have to also think about the generations to come and all the work that we do, and particularly in this conversation, the mental health needs of the people that are coming.
Yeah, there may be folks out there who want to get in touch with you. They want to learn more about what you're doing and maybe take some of it for themselves in different parts of the country. What's the best way to do that?
Well, I would encourage folks to look at our website, www.nativehealth.org, and also get on our social media accounts. You can see some of the fantastic work that we're doing there, because not only are we doing stuff in the clinic, but we're also, the Indigenous Red Market is one of our, community events that really highlights not only the work that we're doing from in clinic, but also, celebrating culture.
Yeah.
And so our social media accounts, our website, and you can get a hold of me at anthony.g@nativehealth.org.
And which social media accounts would?
I think our Instagram page is 7gen1d, 7 generations, 1 direction, on
Awesome.
Instagram, and I think that one's one of our most popular
Awesome.
social media sites.
Definitely. So, Anthony, thanks so much for taking the time to chat. I really appreciate it. Thanks so much.